Hello, everyone. Well, thanks for joining us and not just going to take a nap after all the cheesesteaks that you probably went out for lunch. I know I did. So this is an education committee sponsored event. Who here, raise your hand if you're part of the education committee or have checked it out and stuff. All right. What I love about this is there's a lot of opportunities for new faces. So at the education committee, we do a lot of cool scholarship, and this curriculum that we created was born from one of those objectives that we have, where we were tasked with creating educational resources for the non-educator. And so my name is Guy Carmelli. I'm just really excited to share with you what we've created. I'm going to just have everyone introduce themselves.
I'm Alejandro A from the University of Chicago.
I'm Sarah Dunn from Rutgers, New Jersey Medical School.
I'm Krystin Miller. I'm from Ohio State.
And Carolyn Molins from University of South Alabama.
All right. I'll get things started. So none of us have any disclosures, which is great. Makes our life easier. So as an education talk, well, I actually, we all have to do this, but we start off with our learning objectives. So our learning objectives are really what we hope you can utilize our curriculum for, rather than what you'll be able to get specifically from this session. But we hope that you'll be able to explain the principles of adult learning theory and apply Bloom's taxonomy to create an effective learning objective, to assess the level of the learner and utilize the RIME paradigm, which I'm sure most of you heard about, but you will hear more about it, describe and support professional growth of the learner. 3, identify the pearls and pitfalls that may arise when using adult learning techniques in on-shift education, which is the focus of our curriculum, is on-shift teaching. And then 4, describe the key components of demonstrating competency in a skill and apply various tools to assess and enhance clinical practice. All right. We're done with the worst part of our talk. Okay, so a little bit of background. So who are we? We're the members of the SAEM Education Committee. We represent, it's more than just the folks here that were presenting. It was a larger group that worked on this. And we drew from both academics and community when kind of putting this together, which I think was important. And when we were thinking about the motivation of our curriculum, there was a recent paper in Academic Emergency Medicine titled Estimating the Size and Scope of the Academic Emergency Physician Workforce. And it's quite interesting. They said that 40% of EM physicians work in at least one facility that trains residents, right? So we think about, educators being this small percentage of EM physicians, but really it's almost half, right? And then when you look at the AAMC data, and you go back 10 years, there's been about 18,000 graduates, and they say about like 10 to 15% of those graduates will actually go in to work at an academic center. So you have this kind of two pool of people, junior educators who are working in academic center, and then folks who are in different parts of their career who deal with residents and are not affiliated with an academic site. And both of these pools of people needed something to help kind of jumpstart their medical education career. And so that really served as the impetus for our initial objective. And so in 2023, and that was a couple years ago, but the SAM Education Committee was tasked by SAM to organize a bedside education resource for non-academic and new clinical faculty, and it was titled, So You Want to Be a Teacher. Our subcommittee began with the needs assessment, which if you've done medical education, is the first step. And so we kind of put together all the resources that were out there. And when we did a PubMed search, just using the term clinical teaching in emergency department, and we limited it to 10 years, we got 21,000 hits, which is like crazy. And actually, if you look at just the last year of that, there was 1,000 specifically just on resident feedback. And so obviously that's way too many resources, right? When someone's trying to begin their career in medical education. So we were trying to figure out how could we find like a single compilation of resource, a single curriculum that we could kind of disseminate across SAEM and nationally to get people started. And so we decided to reimagine our objective. And even though SAM told us to just put up a list, we were like, that's not enough. So when we thought about how we could reimagine our objective, we really wanted to focus, what's our goal, right? We want to help new clinician educators. And then we think about who are these people? Okay, so some of them are academic centers, but those have pretty robust faculty development for medical education. While the folks we talked about that 40% who are working in affiliated sites, those are the folks that have really much less medical education support. And so with that, our new Imagine objective became this. So instead of just creating a list of resources, we created a new standardized national curriculum that all new EM educators could use for effective on-shift teaching. Because remember, it was these folks are still worried about productivity metrics and RVUs and all that, so they really needed to have like sound bites for their didactics. So going into our developmental process for our curriculum, based on our needs assessment, we developed a series targeting our new educators. We consolidated into 5 main themes. So when you looked at those 20,000 hits, really things fell into a few categories. It was general principles, it was approach to the junior learner, the novice learner, and then the more senior learner, and then or experienced learner is the term we used. And then there was general teaching techniques and also teaching procedures in general. And so we developed 5 short lectures on those themes, and then we included an educational activity which you could do as like a breakout, and then a handout that summarized all the topics that were given in that lecture. And this was an iterative process, right? So the whole, this subcommittee continued to give feedback as we developed this curriculum, and we continued to make edits. And then once we got it to a place that we felt good about, then we sent it off to national renowned experts, lots of which hold SAEM leadership. I don't think I see any of them in the room right now, but they're people that you would recognize. And so then we incorporated that feedback into the final product, and then ultimately it was published on the SAEM website, which you all will have access to. And so this timeline is really just to tell you that this took a long time. It was a lot of work, a lot of tears and blood. I'm not going to go through the whole timeline. I kind of just described it to you in brief, but it took about 2 years, and it's all on the SAEM website, which we'll get to now. So this is a screenshot of the SAEM website. If you look in the bottom right, there's a QR code. You can go ahead and scan that, and I encourage you to follow along as we kind of go over the curriculum. That's always dangerous because you may stop listening, but I encourage you to continue to listen as you play with your phones. And if you're at home and you wanna access the curriculum and you don't have the QR code, if you just Google SAEM Toolkit, it's the very first link on that page, because I don't know why they put us first, but I'll let you interpret that. And so when you get to the website, you'll see kind of on the top right there's 5 modules that I had just described to you. You'll have a PowerPoint you can download. There is a recorded video that you can use that goes over the PowerPoint. There's an interactive activity we mentioned, and then the summary handout. So I'll pause here just to give you guys a second to scan that QR code, and then I'll hand it over to Dr. Miller over here.
All right, did everybody get the QR code scanned that wants to? Awesome. So like Alejandro said, there are 5 major modules in this curriculum. The first, just some general educational principles, and then moving through the novice experienced learners, as well as the approach to kind of all learners, and some procedural teaching. So Sarah and I are going to kind of just hit the highlights of what you could expect to kind of find, what tools that you'll find in these toolkits for each of the 5 modules. Let's start with general principles. So this is really a module that lays the foundation of some general principles surrounding educational theory and medical education that we feel all educators, whether you're working in a community shop, you've had some formal education training, should be equipped with. So this really lays the foundation. Each module has those learning objectives like we talked about. You'll have some interactive handouts and activities that you are able to access from the website for each of these modules. So some of the things that you can expect to learn from Module 1, really just the approach to an adult learner, kind of covering some of those basic assumptions we make about adult learners and adult learning theory as self-directed, experienced, goal-oriented learners. You'll also cover Bloom's taxonomy in this module and provide you with some tools as you're building learning objectives, learning goals for your courses and your educational sessions with residents or medical student learners. And then finally, kind of really focusing on the RIME framework and how we classify student learners, resident learners in the department as that reporter, interpreter, manager, or educator phase. And you'll see a lot of these themes carried through the other modules. And this is a module that kind of just lays the foundation and would encourage kind of everybody to use as their starting point for the curriculum. Module 2. Module 2 focuses on the novice learner. And so I think this is a really exciting group of learners. They bring a lot of excitement to our department and our clinical shifts every day, but they also bring some unique challenges. As you think about those third and fourth year medical students who are still building that foundation of clinical skills, of foundational medical knowledge, are building their clinical reasoning skills, they can present some unique challenges. And so this module really focuses on some tools that you can use when you are teaching a novice learner on shift. And so you'll review kind of skill levels of the novice learner, and then this module covers 4 basic educational strategies or techniques that you can use when interacting with a novice learner. So covers the 2-minute observation, Aunt Minnie, the SPIT method, as well as activated demonstrations. So those are some of the things you can expect to take away from Module 2.
Thanks. So in Module 3, we examine how to teach the experienced learner. So once again, this is not by years of practice, though commonly in the emergency department, we think about this being more senior residents and maybe fellows. But it really is defined by somebody more advanced on that RIME pathway, so in the manager and educator phases. So these learners are eager for evidence for their own personal practice patterns. They want to be able to explain their clinical reasoning to others rather than just parrot answers. And so they're looking for a little bit of higher level knowledge. The experienced learner group can be challenging as well because many of the educational strategies that we learn are often designed for more junior learners. We may be more comfortable with teaching those more junior learners. This experienced learner wants more evidence-based teaching, and they want to gain knowledge related to uncommon scenarios instead of just the bread and butter cases. This module goes over the skills and goals of that experienced learner and explores 3 techniques: the 1-minute preceptor, effective questioning, and snaps, which are all designed to explore those topics a little bit better. The activity that you'll do in this one is looking at a sample case and applying one of those 3 techniques. Okay. And then in Module 4, we examined 4 techniques that can be used with learners of all levels and consider tips to lead to success in using each of them. It highlights 4 techniques: bedside presentations, ED-STAT, post-it pearls, and teaching scripts. And these techniques are designed to be useful for all learners. They're also really great when you have limited time on shift to teach. They're very quick, they're very adaptable. In this module, we go over tips for using them optimally, and then pearls and pitfalls for each of them. And the activity is using one of them to develop post-it pearls for students using some sample topics. In the final module, we examine how we determine competency and procedural skills, and we also look at kind of what we need to think about when we're teaching procedures, which is its own topic. We will examine a couple of tools to use when we teach procedures. We consider limitations of the see one, do one, teach one method, which everybody has heard, but often has some limitations for our contemporary learner. And so we introduced two new strategies. One is Peyton's 4-step approach, and the other is the learner checklist. This module also highlights best practices for giving feedback when teaching procedures, and the activity uses a think, pair, share to apply one of the techniques to a real-life example of teaching a procedure. As noted earlier, each of the modules includes a handout which summarizes teaching points to reinforce that material and so people can reference it later. And it also includes an interactive activity. Shown here are 2 of them. One is the post-it pearls, and the other is the technique think, pair, share. And so you can use these as a handout in your sessions if you're doing faculty development. I'm going to turn it over to Caroline.
All right, so many of you are now probably thinking, so we know this curriculum, there's these awesome modules, but who is it really intended for? The truth is this curriculum is actually intended, one, for any of all of us, right? Whether you are a senior educator, you can always use some refreshing on one of these. But we really want to target those that are new faculty. So think about someone who is coming into your education environment and needs to get a refresher on how to best teach residents or even students. How about your clinical faculty? Sometimes clinical faculty can leave the department for a little bit and then they come back. They may not be new. They may actually be seasoned attendings who have 10 years of teaching experience, but they may never have had a formal role in teaching someone. And sometimes they need some refreshers. The other one is community faculty. We all know that education is slightly going to be changing in the near future. And a lot of our residents and students are going to be rotating in different places, in different learning environments. And these doctors may need to be refreshed or taught how to teach. And the lastly is we all use residents as teachers, and our fellows are junior attendings and sometimes are the ones that are primary leading as well. This curriculum will target all of those. And so you can target them by many different ways. And the ways that we can do this, or the ways that we envision, right, everyone using this curriculum is really 3 different ways. One, all of you guys can take this curriculum on your own. Imagine that. You can leave here today and do this when you leave SAEM and say, I did not have enough education at SAEM. I want more. So you can do the self-study. The self-study will provide you everything. It gives you the handouts. Yes, you'll have PowerPoints, but you're going to be like, who wants to sit through this PowerPoint? Nobody does. There's going to be a video underneath, someone teaching you about what's actually going on. So yes, you can take it on your own. Second one that you can do is, we all have faculty meetings. I think everyone has had a faculty meeting in their lifetime. The best way to incorporate and to progress knowledge for all faculty, even your chairs, is going to be to put 15 or 20 minutes of this built into your faculty development sessions or your faculty meetings. And how do you do that? Guess what? It's prepped for you. There's a PowerPoint. There's a handout. All you got to do is do a small group, introduce the topic, and just think, pair, share, and talk through it and make it interactive. And the last one is, if you are a leader in your department and you say, I have 10 new faculty and I want to do some onboarding for my medical educators, these new people that are coming in, and I want to prime them, prime time, ready to go, July 1, 8 a.m., we're ready to go, you're going to do a workshop. You can do a 2-hour workshop, you can do a 4-hour workshop, you can do a workshop however long you would like it to be. You can, have some fun with it and it, go somewhere fun. But it's all incorporated for you, right? You'll have the PowerPoints, you can create the small group sessions, and you can do all of that. So really, what is the future? Well, 6 months ago, as we were putting this all together, our videos weren't up yet on the website. They are there, they are live, they're active. You can click on them. I think it's through the YouTube channel, right? Is it? Yeah, it's through YouTube or Vimeo. So the next thing was further distribution. That's what we're doing here today. We're telling people about this toolkit, about this new great faculty development that there is that you guys can do on your own. And the last but not least is, obviously, we need feedback. We, the education, this group of people that's here and those that we'll acknowledge in just one second, we all need your feedback. Did you like it? Could we work on something? Could we make something better? There's enough deliverable, but we want more. Let us know, right? And I'm going to tell you how to do that in just one second. We do want to take in a moment to acknowledge, just like Dr. Palma mentioned earlier, we are only 5 people here, but this is the whole group of people that actually developed this curriculum. It is not at the hands of just a few. It is of the many here, and all of our editors as well, and our expert reviewers. And then the last but not least is just this, right? So on the left, if you did not click the first QR code, that's the one to the curriculum. The one on the right is to get involved. If you are, anyone who's in the room, you can click it and you can put, I'm going to do it myself. That'd be great. If you are someone who is leading a group, or you're a program director or even a chair, and you'd like to create this as a faculty development and do a workshop, the information is all there. Click the QR code. We can help you through that, and we can also just troubleshoot and anything else that you need as well. I guess the next is we will open it up to any questions that anybody might have, and if not, we can do a quick demonstration. Clear as mud. Got it.
And that QR code on the right takes like 15 seconds to fill out. It's really just saying, hey, I'm going to use your curriculum. And then in the future, we can, when we create our survey for feedback, we have a list of folks who can send it to you. So it's not a lot of upfront work, and then you can ignore our email if you want to fill it out, but at least do this intro. It'll help us just have a database of people who can reach out.
So before you leave, one last thing, guys, this is free. So even if you have people that may not have an SAEM, or your department only sponsors one membership to something, right? You can still access this information and this curriculum, and you can get it. Or you just know somebody that can. There's no logging in. There's no passcodes. There's nothing. We'll actually gonna demonstrate now real quick for all those who would like a quick demonstration.
So if you click on the module,
Right, you slide all the way down.
summary, and then you can click on this to maybe open it.
Yeah, it downloads the,
For you.
yep.
And the same for the activity sheet and the handout. And then if you slide down, there's a video. I don't know who's in this video.
So I think people in the back can't hear. So if you just click on those areas, it'll give you the PowerPoint. It'll give you the PDF of the tips. And then obviously there's the video that through YouTube that it kind of walks you through. If you notice, keeping with MedEd stuff, the videos are short. They are not an hour and a half long. It's 12 minutes for this one. But they're all under 15, I believe. Anybody else have any questions or anything else?
You guys are stunned with
No, they're excited.
Thank you so much.
Thank you, everybody.